The human metagenome is comprised of three components: the epigenome, the Homo sapien genome, and the human microbiome. The epigenome is a multitude of chemical compounds that tell the genes what to do. When epigenetic compounds attach to the DNA, they can modify its function. These marks are not to change the sequence of the DNA, rather they change the way the cells use the DNA's instructions. They essentially can alter the instructions given by the DNA, and though they are not part of the DNA, they have an impact on the DNA and gene activation. The Homo sapien genome is the classical view of the DNA comprised in the set of genes or genetic material present in all cells. The human microbiome is defined as a collective of genomes of microbes, such as archaea, bacteria, fungi, protozoa, viruses, and other types of microbiota that live inside and on the human body. Today's dental practice is taking on a larger role in the health care of the patient's overall well-being. This gives rise to the term of dental medicine, as you not only deal with these systemic issues in your care, but are also part of the entire healthcare professional groupings. Dentist's role is often narrow-sighted. Looking at the larger picture, what dentists do is to treat pathology that is inflammatory. I focus on 3 diseases that are all inflammatory and all treated in your office. They each appear in one of 3 areas that dental medicine care for. This is dental disease, oral pathology, and respiration. The first is the more classical role that dentists work in. Dentists treat with caries. We restore broken and worn teeth in occlusal disease. And we respond with care to various traumatic injuries in the orofacial region. What is not taken seriously enough due to patients' acceptance of their dysfunction and that dentists are not trained well is the debilitating damage from cranialmandibular cervical disorders. This group of pathologies provide patient pain and dysfunction in not only the facial muscles, teeth, and jaws, but also the neck and the rest of the cranial region. Damage to these structures create not only musculoskeletal stresses, but are inflammatory at a cellular level and damage the rest of the body. They encompass the most important of function that humans need to accomplish to survive. As such, this group is called functional disorders. Functional disorders relate to the need to breathe, chew, hear, sense the outside world, swallow, and talk. Thus, they are called critical functions. Damage to any one of these functions is threatening to the body's survival. It is known that the brain supports their requirements more than any other part of the body. Your treatments truly are not to fix a tooth, but to restore function to chewing, breathing, swallowing, speech, and other critical functions. The second area is that of respiration. Dentists have a role to treat the second most common sleep-disordered breathing pathology, that of obstructive sleep apnea. Sleep apnea, which is treated by dentists with oral appliances, contributes to a variety of systemic pathologies such as heart disease, diabetes, GERD, stroke, hypertension, metabolic diseases, and pregnancy complications. Sleep apnea is highly inflammatory and damages the body at a cellular level. Dentists not only can treat the disease, they can prevent it with knowledge of tongue space, with restoring the dentition, providing jaw expansion with orthodontics, and early intervention and referral to physicians to remove tonsils and other healthcare professionals to ensure nasal breathing with proper tongue posture during jaw development. The third area that I will discuss is that of oral pathology in regard to periodontal disease. It is an infectious disease, and the bacteria and cytotoxins damage the body's physiologically overall systemic. Periodontal disease is also highly inflammatory to the body. This chronic inflammation contributes to a development of a variety of chronic diseases. These include cancer, heart disease, diabetes, pregnancy outcomes, pulmonary disease, and stroke. When you are providing soft tissue treatment, I want to stress to you that you are gaining health to much more than teeth. You are providing a reduced bacterial load, reduced pro-inflammatory cytokines, and reducing biochemical responses that are dysfunctional and damaging to the body. To review, We work from a point in healthcare of dental medicine treating a wide variety of processes. The three I am discussing are the cranialmandibular cervical disorders, the sleep apnea, and the periodontal disease. As different as they all sound, they are all causing damage directly, systemically, and are all inflammatory, and thus can adversely affect overall systemic health. They all contribute to systemic chronic disease.